once mom is stable, the provider is always going to take a look at the placenta, just make sure it's all intact, or if there's, make sure the umbilical cord was attached here in the middle, or it was off to the side, whatever the reason is. And then when we take, typically when we cut, once we clamp off babies and we put a security, so usually they'll have, sometimes they'll get a security band on, or we're trimming their cord. We always take notes of how many vessels and veins are in the umbilical cord. So does anyone know how many arteries are in the umbilical cord? 2 arteries, and then how many veins? One. So 1 vein, 2 arteries. That's going to be your normal. Okay? 2 arteries, 1 vein. 2 arteries, 1 vein.
2A, 1B.
And then if you guys do go to clinical and you do delivery, take a look at the umbilical cord. So you can definitely see the big old vein, and then you can see the 2 arteries. So, yes. So sometimes we'll do get some gases. So if baby looks like crap on the monitor, we want to see if they're acidic. So we'll draw blood from the vein. Always do the arteries first, so the smallest portion first. So we always take blood from the artery, and then we'll get pulled from the vein, because the vein is usually easy to go ahead and draw blood from to get cord gases. The arteries are a little bit tougher because they're so small. So
they just squeeze it though. They didn't pick.
So I'm thinking of a number between 1 and 10. Team 2, pick a number.
7.
Okay. Team 1. 3. That's 5. That's awesome.
Try it over so we get.
Okay. My favorite color is Team 2. Purple. Pink.
That's 2 answers. Which one?
Come on.
My favorite food is what? Team 2.
Pizza.
What the heck? I give up. Okay, think of a number between 1 and 10.
Me?
Yeah.
Okay.
Okay. Team 2, pick a number.
7.
Team 1. 3.
I
5.
thought
Okay.
they'd change it up.
No.
Okay, I'm just gonna say Team 1. We'll just say Team 1. Okay, so anyone from Team 1. So we have our categories. We have fetal monitoring, contractions, postpartum. Then we have postpartum / breast care, and then our miscellaneous. And I apologize if the questions sound a little bit weird. I made it up, so I make mistakes.
300.
Which one?
Postpartum breast care.
How much of the nipple should be in the newborn's mouth for a good latch?
Oh, right there.
Me?
Yep,
Yeah.
you.
Okay.
Part of the areola and the nipple.
Yes, nipple and some of the areola should be in the mouth of the newborn. Good job. Okay, Team 1. Let's go postpartum for 300. The patient is reporting unrelieved perineal laceration pain 4 hours after vaginal delivery. What action should the nurse take?
Same person.
Check the bladder.
So unrelieved, okay, so think of it, so this patient is having pain. How are we gonna add our good relief?
Call the provider, right?
No.
Ooh, right there.
What intervention?
Just pain medication?
Pain medications could be one. So if we have, our patient just delivered vaginally, she had a 2nd degree, she looks a little bit swollen. So what can we do?
In the back.
Assess the perineum.
Well, that too.
Next would be paradigm.
Ice. So remember, how long do we ice for? First what?
24 hours.
24 hours. So we can use ice packs. So sometimes we can use an ice pack, or we usually take the diapers and fill it up with ice that way to help put that on the perineum. Or a cool sits back the first 24 hours, then we can do warmth after 24 hours. Okay?
So, yep.
Okay, Team 2.
Contractions for 300.
What does tachysystole so many.
Oh, I know that one, but it was, right, she dropped her hand again.
No,
So
never
you-
mind,
right
I
there.
don't remember.
Come on, girl. So if I'm saying in a 10-minute period, how many contractions do they have?
5.
Okay, normal contractions, if they're every 2 minutes apart, in a 10-minute period, how many contractions am I having if they're 2 minutes apart? 5. Anything more than 5 means what? Tachysystole. Good job, guys.
Greater than 5.
Yeah, so having more than 5 contractions in a 10-minute period is tachysystole.
That's mine.
I did this like, there was a few, so I was reading it.
Team 2, pick another.
Miscellaneous 400.
Nice.
Oh, why is that so small? Name 2 signs that precede the onset of labor.
In the front.
Spontaneous, or abruption of membrane, and then, contractions within 2 minutes apart.
Team 2. Wilson.
Contractions that don't go away whenever, like, movement,
Okay.
and then
Come on, guys. The most important one I told you, that'll let you know if it's true labor. Cervical changes. Yes. I'll give that to both of you guys, but know this for the exam.
Good lord. Okay.
All of that. Preceding labor. So just know, if they have backache, the lightning, cervical ripening, so cervical changes, rupture of membranes. Yes, contractions.
So cervical change, that's the.
Cervical change is gonna be,
No.
that's gonna let us know if they're in true labor, at least. Preceding labor, you know, they have that, one to remember, a burst of energy is also referred to as the what period?
Nesting?
The nesting period. Okay, team 2, pick another category.
fetal monitoring 200.
The nurse is observing variable decelerations. What does this indicate?
In the front, right there.
Uteral and cord
Cord compression.
Huh?
Cord compression. Cord compression. Cord compression, variable deceleration. So what does our variable deceleration look like?
A V.
A V, so it's an abrupt, so usually it goes down by 15 beats per minute from baseline, so the baseline was 130, and you had an abrupt, you know, more than 15 beats per minute, and it goes all the way to the 90s, that's gonna be a variable. And then it goes back up, a V or a W.
A V or a W?
Yes. Okay, team 2 again. Another category.
Postpartum 100.
The patient has a vaginal delivery 1 hour ago and they have saturated 1 perineal pad in 15 minutes. What is the priority nursing intervention at this time?
Right here.
We're gonna assess our, fundus, and we're gonna check the bleeding, we're gonna press
So-
where our fundus is at,
Okay, so
And we're
pressing
gonna
means,
check-
what's another word for pressing?
Palpate.
palpate
Palpate
the
and
fundus,
what?
check the numbers, make sure.
Cradle.
What are we just going to feel for the fundus? Okay, what do we need to do?
Massage.
Massage. Palpate and massage. So either you may see an answer that just says palpate, you may see an answer that just says massage, palpate and massage. First thing to do, if there's any kind of vaginal bleeding, postpartum, we're going to palpate the fundus.
Get it out.
Okay, team 1.
Whatever you guys want.
Postpartum 500.
Oh my god.
Okay, the patient is 2 hours postpartum and the nurse observes a large amount of, that's lochia and several small clots on the perineal pad. Ugh, that's horrible. The fundus is midline and firm. What action should the nurse take?
Over here, right there.
Monitoring another hour, right?
Well, not another hour, so. Close, yeah, so we're going to, so is this normal?
Yes.
Yes, so we're gonna document the findings and continue to monitor. Again, when we're monitoring the bleeding, we're doing our fundal checks and vital signs every 15 minutes for the first hour, every 30 minutes for the second hour.
See, that wasn't so bad.
So now, if you guys don't ever get thrown off, so we said small clots were normal. The large amount of lochia is normal because, you know, she's already 2 hours postpartum, so that's within 2 hours, that's fine, a large amount. And her fundus was midline and firm, which was good or bad? Good. Now, if it told you the fundus was midline and boggy, then is that normal? No. So just know your
What
normal.
if it was above then is that our concern, if it's still above the midline, if it's a plus?
So if it said if it was like +2 and she was having some bleeding, then we may want to get her out to the bathroom.
Okay.
So unless something is telling us, you know, it could be +2, maybe we'll recheck it because her bleeding is okay, or just ask if she needs to use restroom. So that was team 2, right? Okay, team 2, category.
Fetal monitoring for hemorrhage.
The nurse is observing early decelerations on the monitor. What interventions are needed at this time?
Right there, in the front.
There are no interventions needed.
Yes, none. We're gonna continue to monitor because early decelerations are good or bad?
Normal.
Okay, team 1, go ahead, Sam.
Contractions for 400.
I'll let her.
Fetal monitoring for 300.
There are late decelerations noted on the monitor. What is the first intervention the nurse should implement?
In the front.
Is it stop the medication?
Oh.
Stop the oxytocin?
The first thing that, if you see late, what's the first thing that we're gonna do intervention wise?
Over here.
Position change?
Position change, into what position?
Left side.
Left side.
So lateral position, so typically the left side. If not, we can always do the lateral position on the right side, as long as we get as long as we get the patient onto her side. Yeah.
One question, for the mom who I saw with the emergency scene, baby's heart rate was like really late decel, and they had her like on the side and her leg up. Why was her leg up?
Probably to keep her pelvis open, depending on where baby was at station wise.
They normally put the ball there, maybe they didn't have it, like the peanut, they'll put
No,
the,
they did, but it was like emergency, so like baby's
Yeah,
heart
it
rate
could
was
have
in the
been, did they go in during the surgery and do like a badge hand? Like did someone go underneath the drapes and,
I don't
no? Okay, that's the only thing I can think of.
I don't know,
Or baby maybe got a little bit better.
yeah, cause they had her leg like, holding it way up in the air, and I was like,
That was team 2, right?
yeah,
You
yeah.
guys? Okay, so again, team 2. Category.
Miscellaneous 500.
There you go.
What nursing priority action is done following an amniotomy?
Right here, in the back.
fetal monitoring.
Assess fetal heart rate patterns. And also, after an amniotomy, what are we also checking for?
Contractions on mom.
Making sure the fluid is okay.
What could happen? What's a complication that can
Rupture
happen
of membranes.
after the rupture of membrane? What's a
Infection.
complication?
No,
What can happen, something to do with baby?
it can't be
A
open.
cord what?
Oh, like prolapse.
Cord prolapse, yes. That will also let us know with the fetal heart rate, if it comes down, then we may, you know, recheck the patient and maybe the umbilical cord is hanging in the vagina somewhere. We don't know. Okay, team 1 category.
Contractions. 400.
postpartum breast care 500.
The patient's, fundus, is 6 hours postpartum is 2 finger breadths above the umbilicus. What nursing action is needed at this time?
Right here.
Encourage the client to void.
Yes. Assist patient to
That's what I mean.
Okay, teen 2 category.
Postpartum breast care 200.
True or false? Breastfeeding the newborn every 2 hours help with the relief of breast engorgement.
True.
Yes. More often you put baby on, the less risks of that breast engorgement. Okay, teen 2.
Same one for 400.
Name at least one measure the nurse can suggest to reduce discomfort during breastfeeding.
Right here. Yes, you.
Changing the position?
Yep, so change inference position, nipples, start breastfeeding with the nipple that's less sore, apply breast milk. Take note of this. Take note of this. Very important. Yes. Because this looks like a good bit of I think. I don't know though.
Phone's popping up like
What do
it's
you mean?
a concert.
Who answered that? I'm getting confused.
Veronica.
Okay, team 1, go ahead.
Fetal monitoring 500?
Yes.
The fetal heart rate baseline is 130 beats per minute with accelerations noted on the monitor. There are no decelerations. What intervention should the nurse implement?
I saw them both at the same time, but
None, this is none.
Yes, continue to monitor. So accelerations are good. Now if they said there were accelerations but late decelerations, what are we gonna do?
Position change.
Position change.
Lateral.
Yes. Okay, team 1, category.
Contractions 500.
The patient is on 10 units of hour of oxytocin. Uterine contractions occur every 2 minutes, lasting 90 seconds. The baseline fetal heart rate is 130 with late decelerations present. What following action should the nurse take first?
in the middle, right there. Yes, you.
Me?
Yep.
Is it stop Pitocin?
Correct. Discontinue the Pitocin.
Pitocin and oxytocin are the same thing,
Yeah,
right?
oxytocin. Yeah, you'll see it on the test, usually oxytocin.
Okay.
I will take Pitocin. T1, category.
Miscellaneous 300.
A client is in active labor and asking for pain medications through the IV. What nursing actions should be performed before giving an analgesic medication?
Checking cervix dilation.
Yes. Why do we need to check the cervix?
See if they're in.
Because if they're dilated and they go into labor, the pain medicine only can help them that way.
It could
So
stop.
can it go to,
We're
we're giving IV pain meds
Maybe.
to baby. So if she's 8 centimeters, we're giving her IV fentanyl. Then all of a sudden, we gave it to her and 10 minutes later, she delivered a baby. Baby's in respiratory depression. What could be the cause of it? Fentanyl. So we don't give it at how many centimeters dilated? 7. So 7, after 7 centimeters, we won't give it, or if we're gonna notice that she's making a lot of change, very quickly.
Is it only with fentanyl?
Usually the fentanyl, so any kind of IV pain medication through the IV.
Like morphine
But
and all
we
that?
get fentanyl in labor and delivery at Presbyterian. It may be different, I don't know, UNM, maybe some, if they get like Demerol, or sometimes if I'm working.
Okay.
Why is it that they can get it before, like, I guess I don't understand that process, I feel like it would be better if they were about to leave.
For the fentanyl, well, because they're in so much pain, they wanna get the epidural, so then they're gonna get relief with IV pain medications, maybe. But we also need to be cautious when we give it, because it can cause respiratory depression, not only in our patient, but when babies are delivered,
Cause they're not
especially
breathing yet in
because
the womb.
they won't take that first breath right away, so sometimes you may have to help them out a
So
little
they
bit.
can't get that in the womb because they're not breathing yet, right?
But if they're.
Like if they're on the fentanyl, it's not gonna affect them in the womb, it's when they take their breath?
I mean, it affects them in the womb, so it still goes, it crosses the placental barrier, so baby will see that. So even if our patient received it and on the monitor, you may see, you know, accelerations from baby, then all of a sudden, remember I told you that minimal variability, that could be sleep, baby sleeping, sometimes you may see them in that sleeping pattern.
So if they're in there longer, it has time to go through their system?
Yeah.
Okay.
It's fentanyl, it works fast, but wears off fast,
Right.
so that's why we can give it every hour.
Okay.
Where did I give the points to?
Us.
Us, okay, team one, go ahead.
No, I'm
Oh,
sorry.
no,
I'm-
team two,
I'm
sorry,
stretching
sorry,
shit.
8 points to team two, pick category, sorry.
Could you postpartum for forestry?
Patient receives spinal anesthesia for a C-section. In recovery, the patient respiratory rate is 8 breaths per minute. What medication should we give to the patient?
Right there, Veronica, right there.
Narcan, also known as what? You won't see it on. Yes.
And who is this for, our patient, our mom,
Yes.
because of the fentanyl or what?
Yeah, because the spinal, the anesthesia, so it's usually the pain medications that you use, usually fentanyl.
Okay.
Okay, team one.
Contraction 4.
Patient is contracting every 2 minutes, and a category 1 tracing is noted on the fetal heart monitor. What nursing actions need to be implemented?
Right there, middle.
Reposition?
Category 1 tracing, good or bad?
In the front.
Assess the cervix.
Nothing, just watch the patient.
Well, what is the category?
Okay, so our patient is contracting every 2 minutes. So if I'm saying a 10-minute strip, how many contractions are those?
5,
5 contractions, is that
normal.
good or bad?
Good.
Normal.
And
that's
category
fine.
2 is bad, right?
Category 1 is, no,
Normal.
that's good. So that's the only tracing that's good, category 1. Category 2 and category 3, we need to do something. That was just a trick question, you won't have like a category, just know category 1 tracing is good, that's the only category, category 1 is the only one that's good.
So points for both teams?
I like the advocacy right there.
So team 2, I'll have you go ahead and pick a category.
200 contractions.
A client is in labor and having contractions that are 3 minutes apart, which pattern should the nurse expect on the fetal tracing?
Right there.
Moderate variability?
No,
Like these.
you may have to draw it out. The client is having contractions every 3 minutes apart, which pattern in words
Oh, I was saying like.
what should the nurse expect on the fetal tracing?
Which pattern in word?
So contractions every 3 minutes.
Man, it probably looks like little waves, but I don't know.
You guys don't understand the
Right there.
question? You guys don't have
Right
a similar
there.
question.
I
Right
don't
there, right there.
understand.
She's got it.
No, I'm probably wrong.
That's okay.
Don't know.
Contractions are lasting 60 seconds each with a 2-minute rest between contractions.
So what is an asking?
So draw it out. Draw it out. You guys can draw it out. You guys have paper?
How do we draw it out?
Never mind.
Okay. So, 3
You
minutes
wanted to look
apart,
back on the
remember
field
the
part.
boxes.
What does it look like on the strip? That's what she got.
Here, go ahead and, turn the light on. I'm gonna go right over here. Sorry.
No, you good.
Okay, so remember, this is what your strip looks like.
It's always gonna be a 10-minute,
Not always,
but I mean, general ATI?
not always.
So what are you drawing then? Which one is that one?
Okay, so this many minutes? Okay, each little box is how many seconds? 10, 20, 30, 40, 50, 60 seconds.
1 minute.
So 60 seconds. So 1 minute. Here's my first contraction. Contracting every 3 minutes. 1, 2, 3. 1, 2, 3. Okay, so here's my contraction pattern. So there's my first contraction. How do I start counting my contractions?
From the start and the end.
From the start of one contraction to the beginning of one
Beginning.
contraction to the beginning of the next one.
Right.
So up here, 3 minutes apart. 1, 2, 3. 1, 2, 3. Okay. Now, the way I'm drawing it, how long are they lasting? If she's contracting every 3 minutes. 1 minute, 60 seconds, and how long is her uterus giving a break?
2 minutes.
2 minutes. So contractions lasting 60 seconds each with a 2-minute rest period between contractions. Take note of this. You will have a question on the exam like this.
Hold on. And then I need your drawing in the back.
And I would suggest if you guys are having trouble trying
Don't forget about your
to
group back
just
here.
draw it. You guys have that scratch piece of paper for a reason. Draw it out.
Don't forget, or do not talk to us.
Okay.
Move your head, bro, I don't want it in my head.
Okay, we good? Okay. Team 2 category.
Miscellaneous 200.
That was
At what
100.
station is the lowermost portion of the fetus is at the level of the ischial spines?
Bingo, right there.
0.
0 station.
That's 100, by the way. She said 200.
Station.
Okay, team 2. Again.
Miscellaneous 200.
Name the 2 prostaglandins used to induce labor.
Potassium.
Raise your hand. Oh. In the front.
Oh, talking about yourself, mesoprostol. Okay, mesoprostol and starts with the D.
Diaphragm. Oh, she said prostate.
Is that right? Prostol?
Yeah.
Yep.
So what are these?
Prostaglandins. So prostaglandins are, so for inducing labor, what are they doing with the cervix?
Opening.
Softening and opening the cervix, causing what in order for that to happen? What are we making that uterus do?
Contract.
Contract, yes.
Hold on. Okay.
Okay, team 1, category.
Postpartum 200.
True or false, a patient who is RH positive and their newborn is RH negative will receive ROGAM.
True.
Oh, right there in the glass.
True.
Oh, wait a minute.
What is it, true or false? True.
Oh.
It is the other way
It's okay.
Remember, to get ROGAM, your mom has to be RH negative.
Babies probably are babies.
Mom got me negative.
Nobody.
Okay, a team 1 to go category.
Postpartum respiratory.
Jeez, the fundus is slightly boggy and deviates to the right. What action does the nurse take?
Right there. You was close. You was second.
Assist the client to the bathroom.
Bogey.
Okay. We'll do contractions. True or false, a continuous contraction lasting more than 90 seconds can lead to uterine rupture.
True. Oh, sorry.
True or false?
True.
True. Everyone good? True? Yes?
Sorry.
Yes. The nurse is observing late decelerations. What does this indicate?
Bingo, right in the back.
Cord compression?
No.
Second was this one.
Uteroplacental
Insufficiency.
Uteroplacental insufficiency.
on, don't, hold on.
Go ahead and put those lights back on.
So that just means basically that it's not getting enough blood or oxygen?
Could be both. Huh?
Both?
So,
Same thing?
yeah,
Yeah,
oxygenated
both.
blood is
Okay.
important to baby.
The flow is
Okay,
compromised.
so for your exam, know that acronym I posted in your announcements,
Feel
Build
Top
Top Mind. That will help you answer at least 6 questions on the exam. What I'll do, for probably sometime Thursday, just watch for an announcement from me. I'll help you guys out when it comes to your 3, next gen questions. So you have the bow tie, 2 bow ties, so know how to answer those. Again, it's color coordinated, so should help a little bit. So you have 2 bow ties, and then you have the matrix. I think that one's gonna be like what's anticipated, what's contraindicated, what order's contraindicated. So there's 3 of those, and then I think I put 5 med math questions. So they're a little bit harder. They're more, like, your your ID line, so your meals per hour. There's gonna be more of those, so hopefully that'll help out you guys, when it comes to med math. But other than that, I'll post some announcements here on Thursday, with those next gen questions, and if I get any of, the study guides, I'll post some more information if I keep getting the same questions. Okay, any questions on anything that we learned today? Oh, sorry.
Where can you find the acronym that you're talking about?
So it's under
Announcements.
announcements, I think I put it under fetal heart rate